Hey guys, it's Emma Vigling with TYT Politics, coming to you live on Facebook, on the Book of Faces. Want to talk to you a little bit about the sausage making, as Hillary Clinton likes to say in her paid Wall Street speeches, the lovely sausage making in Washington. Not so lovely this time, but we do have an advocate. So as you guys know, I've recently been critical of Elizabeth Warren for the fact that she hasn't said anything about Standing Rock. I stand by that criticism, no pun intended. Elizabeth Warren is not showing much bravery on that issue. Elizabeth Warren is so progressive in some areas and really cowardly in others. And I think she's a very complicated political figure. For the most part, I love what Elizabeth Warren does on banking issues and what she's doing right here. Standing Rock thing is a separate issue, but for right now, let's be proud of Elizabeth Warren, because I'm going to break down the nitty-gritty of this big pharma blowjob, excuse my French, although not to disparage the French. The French are lovely people. I love their croissants. So buttery, they make me fat. But not to disparage the French, but yeah. So this bill, 21st Century Cures, is basically a massive blowjob to Big Pharma, and it has bipartisan support. When you hear bipartisan support, red flag, because that means that the corporate Democrats and the corporate Republicans are coming together to screw you. And you know who's fighting them? Elizabeth Warren. So I'll give you guys a little bit of an overview. Today, or yesterday, about 12 hours ago, the House passed the 21st Century Cures health bill. So let me break it down for you, a little bit of an overview. The House of Representatives on Wednesday passed a sweeping $6.3 billion bill that supporters say will spur medical innovation, speed access to new drugs, expand access to mental health treatment, and battle the opioid epidemic. Because, by the way, they care about drugs now that it's affecting middle-class white people. The bill, known as the 21st Century Cures Act, has widespread bipartisan support, including the backing of the Obama administration. Though critics said it gives massive handouts to the pharmaceutical industry while making cuts to public health programs and Medicare. You don't say. When the Obama administration and the Republicans agree, you know you're getting screwed. I'll give you a little bit of an overview from this Vox article, which Vox was in the tank for Hillary Clinton during the primary, but this article really breaks down some of the issues that this bill has, and then I will show you the absolute smackdown Elizabeth Warren lays down. Ahead of the decisive win on Wednesday for the bill, Senators Bernie Sanders and Elizabeth Warren came out swinging against the bill. It's time for Congress to stand up to the world's biggest pharmaceutical companies, not give them more handouts, Sanders said in a statement. And then I will show you and read to you Elizabeth Warren's speech where she goes even more in depth. They are right to be concerned. Researchers who study the FDA have long pointed out that tucked away in the 996-page bill are provisions that will weaken the regulator's authority and potentially compromise patient safety. So, this bill wants to circumvent the FDA. That's basically the whole point of the bill. So, while they're cloaking it in, the opioid epidemic, we want to get these drugs to people faster. Faster means, much like the fast track of the TPP, which is dead for right now, wants to circumvent all of that government bureaucracy. Because government's the problem. Doesn't that sound like a Republican talking point to you? But the Obama administration is behind this. I will continue. So, while boosters of the Cures Act see it as a much-needed FDA overhaul, critics have pointed out that the bill and its previous iterations include provisions that will erode the quality of evidence the FDA uses to evaluate new drugs and devices, making it easier for companies to bring substandard or ineffective medicines and devices to market. Just what we need! Substandard medicine. Thanks, federal government. God, the amount that both sides are bought by Big Pharma is one of the most underreported stories in the past, 5 years or so. Even more. One major concern is that the bill includes language that would allow drug makers to put forward real-world evidence to support the approval of a new indication or use for a drug. In the past, only rigorous clinical trials would do so, but under this new provision, companies can submit safety monitoring data or observational studies as proof that a drug works for a new use. So, what they're saying is that the clinical trials from the FDA are not the standard anymore. In order to get these new drugs fast-tracked, they can just submit safety monitoring data or observational studies. So what we're relying on is the companies to self-monitor themselves. How much does that work? Has that worked in the past ever? You know, the only reason why you pass these things is because you're so cozy with those drug companies that you want to make it easier for them to make profits. If you're actually looking out for the American people, no one thinks that a corporation that's supposed to be making drugs that help people should be regulating themselves. I didn't expect to get that angry in this story, but I just did. Another major concern is a provision that allows drug companies to submit summary-level reviews for new indication approvals instead of raw data, which they currently have to submit in the FDA process. This would limit the ability of FDA reviewers to analyze and crunch data behind a drug for themselves, leaving them to rely on summaries created by pharmaceutical companies. Summaries instead of raw data? So that's what we're doing now. Instead of the FDA taking its time to review the raw data from a drug, the companies themselves get to submit summaries. That's what we're relying on. Summaries can gloss over any of the issues with the drug. Exactly, Jeremy. This country is run on greed. And that's because we've allowed it through a series of disastrous Supreme Court decisions that allow these drug companies to buy off the people that are supposed to be setting up the FDA as an administration that's supposed to look out for you, me, and your neighbor. But instead, they just want to make it easier for the drugs to get through the process already. The article continues from Vox. Faster approvals doesn't mean better drugs, you don't say. Proponents of the bill say they'll bring cures to patients faster by streamlining the FDA process. Bullshit. But critics have also taken issue with the basic premise that a sluggish FDA process is what's blocking innovation. There's no evidence that the FDA blocks innovation or makes innovation harder or makes it more costly, says Harvard's Aaron Kesselheim, who has studied previous iterations of the bill. Yeah, don't listen to Harvard. The goal in drug development isn't merely innovation, it's innovation that works to help patients. That's what drugs and pharmaceuticals are supposed to be. Wow, what a novel thought. Right now, the FDA is actually the fastest regulatory system in the world, with several expedited approval pathways for important drugs, but that wasn't always the case. The FDA under Ronald Reagan in the 1980s was underfunded and sluggish in approving new drugs, and arguably held back innovation. So, they're trying to, essentially, make it faster than it already is. And the United States, despite being the wealthiest country in the world, has the highest drug prices, as Bernie Sanders so aptly pointed out during the primary. So why do we need a regulatory system that circumvents that FDA for even more expensive drugs? Maybe they should be looking into those drugs saying, do they actually help people before they charge people inordinate prices for them? But I will add a caveat, as Elizabeth Warren will. The reason this bill is getting bipartisan support is not just because it's a corporate blowjob, a big pharma blowjob. They're also sticking in important provisions, because that's how the sausage making that Hillary Clinton so desperately loved and talked about all the time works. They extort sometimes well-meaning but weak Democrats into and Republicans into passing bills that go against many people's interests because it gives them a little crumbs in there. The bill also boosts spending on potentially life-saving research. Even critics acknowledge that, along with the provisions that erode FDA authority, are some very alluring boosts for medical research, including President Obama's signature projects, as well as funds to address mental health and the opioid crisis. The bill would increase much-needed funding for the National Institutes of Health in the order of $4.8 billion over 10 years to help support Obama's medical research programs, including the Brain Research through Advancing an Innovative Neurotechnologies Initiative and the Precision Medicine Initiative. The bill also includes $1 billion in funding over 2 years to help state governments with opioid painkiller abuse prevention and treatment programs, and $500 million for the FDA. But it's not that bad of a bill. Look, it gives opioid research. But that kind of mentality just continues to erode our regulatory process. So when you continue to just give crumbs, then the large bulk of the bill is what actually takes its effect. And that's what's been happening under our corrupt government for decades at this point. Hope and change, Obama. When you didn't do anything about campaign finance, these are the resounding results. But Elizabeth Warren, to her immense credit, and you know I was just critical of her in a video I did, is standing up.
But pushing treatments without scientific evidence that they work is fraud. Fraud that can hurt. It also undercuts the development of real cures. And that is why some of the largest law enforcement actions against big drug companies over the past 15 years have involved off-label marketing. Drug companies have paid billions of dollars in penalties. Now, one solution would be for those companies to follow the law, but they prefer Plan B. Cozy up to enough people in Congress to pass this cures bill that would shoot holes in the anti-fraud law. In other words, make it easier for drug companies to get away with fraud.
She keeps saying fraud. Let's go, Elizabeth Warren.
Now, the drug companies could have responded by ending kickbacks to doctors. But instead, they've chosen Plan B again. Cozy up to enough people in Congress to pass this cures bill that would let drug companies keep secret any splashy junkets or gifts associated with so-called medical education and make it harder for enforcement agencies to be able to trace those bribes.
How refreshing is it? How refreshing is it to have someone in Congress, have a senator, a high-profile senator, just saying it out loud? Bribes. Bribes. That's what they are. They're bribes. And I just love that. So, yeah, again, I know, I'll get so many comments. She's a sellout. I know, I'm disappointed in her in so many ways. Like, it's not black and white. But on this issue, she's killing it. She's killing it, guys.
According to news reports, a major Republican donor stands to benefit financially from selling cellular and regenerative medical therapies. If this guy had his way, he'd be able to sell them to desperate people without a final FDA determination that those therapies were either safe or effective. Of course, that would be against the law right now. So this mega donor has poured millions of dollars into Mitch McConnell's personal campaign coffers and into his Republican super PAC, and now he wants his reward. The Cures Act offers to sell government favors. It delivers a special deal so that people can sell these treatments without meeting the FDA gold standards for protecting patient safety and making sure that these drugs actually do some good.
The fact that she just called out Mitch McConnell on the floor like that, like, Elizabeth Warren has more balls on specific issues, very specific issues, than 95% of the men in Congress. She just called out Mitch McConnell on the floor for being corrupt. And that's refreshing because a lot of the time when you see Democrats grandstanding, it's for publicity, and it's really just within the game of politics, the game that's been set up as, I take these donors, you take these donors, and we're all gonna have a party afterward. Let's all have tea and cake. But Elizabeth Warren's like, I don't want to be friends with Mitch McConnell. His campaign coffers are being lined, his personal campaign coffers are being lined by this Republican donor who wants a payoff. Yummy in my tummy. She continues.
There is a lot of bad stuff in this bill. A lot of bad stuff. But not everything in the bill is bad. Republican leaders are playing a crafty game here, trying to buy off Democratic votes one by one by tacking on good, bipartisan proposals that senators in both parties have worked on in good faith for years. There's a bipartisan mental health bill, bipartisan provisions protecting the genetic privacy of patients, bipartisan provisions to give some very limited funding for important priorities like the national opioid crisis and the Vice President's cancer moonshot. There's a proposal in here to improve foster care. I support most of these proposals. I've worked on many of them for years. I even wrote some of them myself. If this bill becomes law, there is no question it will contain some real legislative accomplishments. But I cannot vote for this bill. I will fight it because I know the difference between compromise and extortion.
Ooh, I know the difference between compromise and extortion. I want to get that tattooed on my forehead. I know the difference between compromise and extortion. Actually, every Democratic lawmaker should get I know the difference between compromise and extortion tattooed on themselves. Because they don't seem to know. And there's a reason. It's because they're paid not to know the difference between compromise and extortion, and strong Republicans get funded and weak Democrats get funded. But Democrats and in this new era have to understand the difference between compromise and extortion. And yes, this bill just got passed, and Obama likely is going to not veto it and send it through. But the only way that we get corporate Democrats like President Obama to not do these things is from pressure externally. And yeah, you can say Elizabeth Warren, yeah, she's a sellout in some areas, yeah, she should be speaking against Dakota Access Pipeline, but when she grandstands, as some corporate Democrats like to derisively say, she's getting attention on this issue. And if Obama passes this, I'm going to do a video, and I'm going to call him out about it. The House has passed it, and we will watch. This is the lame duck session where you're supposed to be protecting your legacy, President Obama. Why is a senator doing the better job of standing up for the American people than the President of the United States who preached hope and change? And lastly, this is what goes to show why Elizabeth Warren is better than an overwhelming majority of lawmakers in Congress. Low bar, but this is why lawmakers and Democrats and Republicans, corporate Democrats and Republicans, don't like her very much. When she called out Mitch McConnell, which I just loved. Her charge against Mitch McConnell inspired Senator John Cornyn from Texas, who's also the Senate whip, which is a massively important position that does not get discussed. So, her charge against McConnell inspired John Cornyn to rise to his defense and accuse her of violating Senate's decorum. Oh, good madam, you violated the decorum of the Senate by calling out the Honorable Mitch McConnell. How dare you, madam? Well, the rest of us love it. But Warren has not found a lot of allies in her fight. I wonder why. I understand that there's a desire to immediately show some backbone and some fight, says Senator Chris Murphy, Democrat of Connecticut, a major supporter of the bill, who authored major mental health policy legislation that was included as part of it. I think that this is the wrong place to make that stand. There's going to be plenty of life or death fights once Donald Trump is president. Chris Murphy, I recall you getting a ton of praise when you stood up for gun legislation. You stand up when 85% of American people want background checks and when it's the easy fight, and you do the sit-in on the floor of Congress. You're a senator, not House. You do all of that stuff. But when the fight is hard, when you have to stand up against the drug companies, and I'm sure that, I didn't look into it, but I'm sure there are a plethora of them in Connecticut. I know there are a ton in the tri-state area, because that's where I'm from. Then it becomes a little bit harder, and that's when you have to say, oh, I understand that there's a desire to immediately show some backbone and some fight, but it's the wrong place and the wrong time. When's the right place and the right time, Chris Murphy? On Tuesday, Senate Democrats gathered for a private lunch to hash out strategy around the bill. It was, according to sources, less tense than expected as Warren's effort lost steam. Of course. But it was a much feistier meeting than customary. I think that tension is productive, Senator Cory Booker said as he was leaving the meeting. In the last several hours, we just won some more concessions. But not the right ones, I'm sure, Cory Booker. If you're the one saying that they are concessions, doubtful. Alright guys, have a great day.